Okay, what about fevers? Well, fevers are a natural way for our bodies to fight infection. Many viruses cannot survive at a temperature over 100, so our body creates that temperature to fight the virus. Fevers can also be a sign of a more serious infection, which is why most people are nervous about fevers. Babies under 3 months in particular need an appointment early if they have a fever. Some children, especially if they have not started their primary vaccination series, may need to go to the ER if they have a fever. We do not try in very young babies to hide the fever with Tylenol or ibuprofen. For older babies or children, try the fever-reducing medicine. Try Tylenol or ibuprofen. And as a reminder, the dosing chart is on the website. Children with fever don't feel well. Bringing the temperature down using these fever medications will help them feel better. If your child is under 2 and has a fever for 3 days or more, please give us a call. If your child is older and has fever for 5 days or more, please give us a call. You don't have to call us on the first day or first few hours of the fever, unless your baby is very young, under 3 months, or has another medical problem. When your child has a fever, look for other signs of illness. That might tell you why your child has a fever. In addition to these respiratory viruses, right now we're also seeing stomach bugs that cause vomiting and diarrhea. We're seeing hand, foot, and mouth virus among the toddlers, which causes sores in the mouth and sores on the palms and the soles. These may be helpful signs as to why your child has fever. If we can figure out why your child has fever, your child does not necessarily need to be seen. Fever that goes with certain other symptoms do need to be seen. For example, if your child has a fever and it goes away and then it comes back, then we're wondering, why did it go away and then come back? Is there a secondary infection, like an ear infection or even a lung infection? We want to see those kids. If your fever does not respond to medication. Now, this is an interesting one because if your child can mount a fever to 103, Tylenol or ibuprofen may still bring it down to 102 or 101. Your child will still have a fever, but the fever-reducing medicine is actually working. So if you use ibuprofen, for example, you can also use Tylenol at that time. If your child has specific symptoms, we definitely want to see them if they have a fever along with them. For example, if they have a stiff neck, if a child cannot tip the chin down to look toward the belly button, this could be a sign of a severe illness, and we want to see your child. If your child is now dehydrated, there's hardly any urine output, and the child is lethargic, that's definitely a reason we need to see your child. If your child has fever and vomiting without any diarrhea and without any improvement over days, we need to see your child, because young children, that could be a sign of a urinary tract infection. Lethargy, other difficult problems where it's not responding to fever reducers may be a good reason to bring your child in as well. What can we do to try to prevent all these infections? That is unchanged for all of time. Washing your hands is the #1 way to prevent infection. It's really hard in our toddlers who put everything in their mouth, but wash their hands as soon as they get home from preschool. Wash hands before eating. That is the #1 way to prevent infection. If your child is sick, have him or her wear a mask. If you are sick, have him or her wear a mask. There are some older children who are well enough to go to school but may still be coughing. If they wear a mask, they may be able to decrease the spread of whatever virus they have right now. The third important thing that you can do is get vaccinated. We do have vaccines against COVID, and we can do bivalent boosters for those who have finished their primary series. We do have flu vaccines. They're both available, both in our office and at local pharmacies. Get your child vaccinated so we can decrease the likelihood that your child has more than one virus at one time. Don't forget to get your routine vaccines as well. We don't need something like a measles outbreak or pertussis outbreak on top of everything else that's circulating right now. This is shaping up to be a tough winter, and we hope that all of our patients understand we're doing our best to try to get to you, get you the best advice, and get you an appointment in a reasonable amount of time. If you can follow these advice that I just gave, hopefully it'll make it easier for you and everyone else to get appointments when you need it. Thank you.